everything that we do is basically to make, is to apply our judgment to make decisions in a realm that we're expert at. The realm I've chosen is the realm of understanding how the body actually moves. And that's not typically something that you talk to your medical doctor about. They're much more concerned with the nature of how you feel, but not how you move in this world to accomplish things. And that's what I would call the third realm. That's the realm of physical medicine. And that's my specialty, and that also has its rhyme and reason. The new thing, the new scientific thing that has entered my life in the last year is a method of understanding how the body is able to organize itself so that if I want to take a step forward, I have all the data I need to make a step forward. If I want to reach to bring a book down from a bookshelf, I have all the data my body needs. It knows when my hand's in space, it knows what the tension is in the muscles, it knows what tension that muscle needs, what changes in that tension need in order to accomplish that task. All of that information is apparent in the body, like it's a book. You just need to know where in the body to find that information, or where the likely places are to find that information. So about 20 years ago, this physical therapist in Italy sat down, basically analyzed the body as the task that the body has, physical task, is to move, and just looked at it as a moving machine. And set down maps, the body, so that each joint has to move in basically 10 directions. We would say 3 primary directions that are similar to the XYZ planes that we study in geometry. You have to move forward or back, left, bend left or right, or twist left and right. And from that basic data, you can map out all these points in the body, which we've heard of as trigger points, as acupuncture points, as pressure points. But what he did is he systematized why these points happen here, because they coordinate this particular movement. And if you know that map, you have a tremendous advantage in understanding suffering. And not only suffering, not only the experience of pain, but the ability to move. So we've got the two sides of the body that's active, that moves into the future, that makes decisions, and the body that experiences life, loss, joy, whatever. And that's all in here. And that's all contained in the treatment of physical medicine. The really wonderful thing about that map that this guy discovered is that it's very similar to the map that was discovered 3,000 years ago by acupuncturists in Japan. The points they're not identical, they're understood differently, but they're in the same place. That is, and for me, that was real confirmation, because I had always been drawn to acupuncture theory because of its immediacy, of its ability to produce a sensation of aliveness, of being healthy.